A needle stick injury, or a NSI, is defined as an accidental skip penetrating step wound from a hollow bore needle or the sharp needle, which is containing the another person's blood or the body fluids. Now, sometimes it's also called the sharp or the precutaneous injury. Now, the agents which is transmitted by the NSI, there are some examples like the hepatitis B virus, hepatitis C virus, or the HIV, which are the three major blood-borne viruses that are transmitted through the NSI. Now, the risk of this transmission is the highest in the hepatitis B virus, which is followed by the hepatitis C virus and HIV. Now, we are talking about the infectious specimen for the NSI. Like we have a potential infectious body fluids, which are including the blood, genitals, like the genital secretions, like the semen and the vaginal secretions. Then the other body fluids, like the CSF, synovial fluid, peritoneal fluid, precardial fluid, or the amniotic fluid. So now we are talking about factors that influence the risk of contracting infections in following the NSI. So first is the type of a needle. Hollow bore needle has a higher risk than the solid needle. Then second is the device visibly contaminated with the blood. Third is the depth of an injury. So the higher is the depth and the more is the risk. Then fourth is the volume of a blood involved in the exposure. Then fifth, a viral load present in the blood at the time of exposure. And the sixth one is the timely preforming first aid.
We are talking about prevention of needle stick injury. There are two types of prevention. First, precautions during handling needles, and second, precautions during surgical procedures. First, precautions during handling needles. Standard precautions must be followed, such as hand hygiene and appropriate use of PPE, personal protective equipment, which includes gloves, gowns, masks, and goggles while handling blood and body fluids. Then, work surfaces must be disinfected with 0.5% of sodium hypochlorite solution. Then, HBV vaccination, hepatitis B virus vaccination. Healthcare workers must be immunized against HBV spillage of blood and other body fluids must be promptly cleaned and surface disinfected. Then disposable needles should be used and also needles must be disposed into the sharp box immediately after use. Second, precautions during surgical procedures. During surgery, sharp instruments should always be passed by non-touch approach, not directly by hands. Needles must never be picked up with the fingers while suturing. Forceps or a needle holder is ideal for holding a needle. Patients known to have blood-borne virus, BV infection may require the following additional precautions for surgical operation: double gloves and trained staff only.
We are talking about step of post-exposure management. First is the first aid. Second is the report to designated nodal center. Third is the take first dose of post-exposure prophylaxis of HIV. Fourth is the testing for blood-borne viruses. Fifth is the decision of post-exposure prophylaxis for HIV and hepatitis B virus. Sixth is the documentation and recording of exposure. Seventh is the informed constant and counseling. Eighth is the follow-up testing for health care workers. And ninth is the precaution during the follow-up periods.
Let's start the steps. First step, first aid. First aid is to be started as early as possible. Second, report to the designated nodal center. Nodal center perform the following function as mentioned below. Take first dose of post-exposure prophylaxis for HIV. The first dose of post-exposure prophylaxis for HIV should be taken as early as possible. effect is maximum if taken in less than 2 hours, and the effect is nil if the taken after 72 hours of exposures. If the HIV is negative status of the source is documented in patient's case record in hospital information system, then the first dose of post-exposure prophylaxis is not required, and if the test report is not available, the administer the first dose of regimen immediately without waiting for the laboratory results. Fourth point, testing for bloodborne viruses. The test format should be rapid and results should be available within 1 to 2 hours. Anti-HIV antibody detection test, hepatitis B surface antigen detection, anti-HCV antibody detection, and the last is the anti-hepatitis B surface antibody test. Decision on post-exposure prophylaxis for HIV and hepatitis B, informed consent and counseling. They provide the psychological support, documentation and recording of exposure. A structured performer should be used to collect the detailed information, and for prophylactic treatment, the exposed person must sign a consult form. Follow-up testing of healthcare workers for a bloodborne virus should be done if the source status is positive or unknown. HIV testing follow-up is done at 6 weeks, 3 months and 6 months after exposure. Hepatitis B and hepatitis C follow-up testing is done at the 6 months after exposure. Precaution during the follow-up period, especially first 6 to 12 weeks, refraining from blood, semen or organ donation, abstinence from sexual intercourse or use of latex condom till both baseline and 3 months HIV tests are found negative. Women should be not breastfeed their infants, and the exposed person is advised to seek medicine evaluation for any febrile illness that occurs within 12 weeks of exposure.
आपसे फिर मुलाकात होगी, तब तक अपना ख्याल रखें, सुरक्षित रहें और याद रखें, सही वक्त, सही कदम, सतर्क रहें। जय हिंद।